last one. Okay, what we're going to do now is Botox, okay? So what I usually tell people, Botox in general works for 3 areas. It works for the forehead horizontal lines, it works for the crow's feet lines, and it works for, you know, what we call the angry or Levin lines, the ones that you really don't have. Are we doing that? Okay, we're going to do it anyway, just for show. So anyway, it works for those 3 lines. It works for other areas too. It works for getting rid of sweating in your underarms, and your palms. It works for TMJ, if you have TMJ problems. Some people don't like dimpling in their chin, so we sometimes do it for that. Sometimes we do it for upper lip lines, although as we just talked about, the fillers actually probably work better for that than anything else. So, so what we're going to do for her today is we're going to do the horizontal lines. Raise your eyebrow. We're going to do the lines that she has.
I do have some.
We're going to do these crow's feet lines, and again, we're going to do the glabellar lines. Okay, so we do not numb up for Botox because it's relatively not painful. So we're going to start with the crow's feet lines. And so you basically do 3 shots here. Does that hurt much?
No.
Okay.
This is the first time I've had that area done.
Good.
It's pretty painless.
How many units are you putting in each place?
On average, each area gets somewhere around 20-ish units.
How long does the Botox last?
Botox lasts for about 3 months. It's variable. Some people last longer. Some people obviously last shorter, but on average, it's about 3 months. And the Allergan published data is 3 to 4 months. Okay. So it doesn't work at all for about 3 days, 3 to 5 days. And then kind of around that 3 to 5 day period, you just kind of wake up and say, oh, where are those lines? Okay. She doesn't have ingrained lines, and so a lot of people wonder, you know, or complain actually, that the lines don't, those ingrained lines don't actually go away. And it won't go away because all Botox does is it makes the muscle not work. So you can't make those lines worse. But it won't actually take it away if it's pretty ingrained. But if you do it consistently, it probably will go away over time. Okay, so squint really hard. So you can see the muscles pulling this way and here, and so we'll get that. Okay, no, I'm sorry, relax.
So when the Botox wears off after 3 months, do the wrinkles come back with a vengeance, or is it just...
No, actually
what they've always
they're
been?
better than they started out.
They're better because that muscle hasn't been moving that skin for that period of time, and as the muscle moves the skin, that's how you get the permanent wrinkles that we talk about. The difference in just seeing movement and actually seeing a wrinkle in the skin. Over time, you'll see a wrinkle in the skin. So, yeah, it's good. So a lot of our patients, we have patients of all ages that come in, some that do it at this stage for prevention, and then some that, you know, come to us a little bit later and are doing it just to catch up because they're noticing the lines.
So actually, Angie just brought up a really good point. Botox is basically for treatment, but it also, we use it for prevention. Okay, I really believe that it slows down the aging process. For example, these glabellar lines here, those lines, if she squints really hard, what does that do? It brings down her brow, okay? And if she makes a big smile, what does that do? It also brings down this lateral brow. So if you do Botox here, for example, it actually raises your brow. So over time, the brow doesn't fall as fast, I believe. Okay, because it's like any muscle. If you use it a lot, it's going to start bringing tissue down because tissue is lax. So if you are consistent with the Botox, even when you're younger, I think your brow doesn't fall as fast as you get older. So that's what I think anyway.
I agree. Me too. I concur.
So when you say brow, Does that, I mean, I think of a droopy eyelid. Is that very different from a brow or?
Well, that eyelid has two components. It has the brow, which falls. So if you look at her eyelid now, if I push that down, her eyelid looks like it has too much eyelid.
Yeah.
Okay, so if I raise that brow, she has less eyelid. So it has two components. One, the brow falls, but secondly, as you get older, you have extra skin. And so some people need to treat just the eyelid, and some people need to treat just the brow, and some people need to treat both. The easiest thing is just to treat the eyelid. Okay, squint really hard. We have some left. See, we call these bunny lines, so we can treat those too. So just because we have some.
Awesome.
Because she's the older sister, she's gonna
Oh.
she'll need a little more.
The truth comes
Dig.
Is she gonna look younger than the younger sister?
Angie's next.
Okay. Anyway, that's done.